As promised, I don't want anybody to mix a question on mental health on the NCLEX. This is the last series, the third of all. This is to summarize everything and to give you more questions. These three series, if you look at all the three of them and watch them, there's no question in mental health that you get it wrong. This is designed to help you make you comfortable with mental health that people usually are afraid of. That's what the ankle is like. So series number 3 and the last one. And so let's get to it. This is the way I want you to learn mental health fam. Every day, just write all this list. You can take a picture of it and look at it and see if you can circle like a puzzle. Circle the different classes of drug. If you're able to do that every day, you mastering the name, and you master the content later. But the name to recognize it so that your eye can picture them and figure out. So the first one. This is just a quick question. It's not a question just to get you thinking. If you can recognize TCA, if you can see it, then you're doing great. So this is one of them. Okay, this is a TCA. This is another TCA. I'll circle a few of them. But look through and see if you can see any TCA over there. This guy is a TCA. It looks different. So look at it. Keep on doing this every day. By the time you get to your exams, you know all these drugs. But this is my tip for you to be able to recognize these farm on mental health. So these are those medication. A few of them are put it together. You can circle them and then you can study easy way. Now let's get to it. What is this? First question, test taking skills, right? I'll give you a diagram and I ask you what it is. Select or apply. Which of the following medication are possible culprits? So they are the problem. And next is doing medication reconciliation on the client whose EKG show the findings below after starting a new medication. Keyword, new medication and the EKG changes. Those are the buzzwords. That's all. Rewrite the question. I started a new medication. All of a sudden, I have an EKG changes. What do I have? I have this. I've given you the length of a QT, and this is longer. Therefore, long QT prolongation. What is the question is asking you? Which medication causes QT prolongation? That's you just rewriting the questions. You can take ownership of it. So rewrite the question. We take your ownership. Prolonged QT. Which medication? Most of the second generation antipsychotic causes that. So this is the second generation. This is the second generation. This is the second generation. TCA also causes that. This is a TCA. This is a mood stabilizer. Does not cause QT prolongation. So which of these causes the problem? 1, 3, 5, 4, and 5. So these are the problem. 5 is not one of them. So this is the way you answer questions and then test taking strategies. Okay. Next question. Same thing, same strategy we're going to use. The nurse should anticipate which prescription from the provider. You see, I keep on reading from the back. What prescription do I need? It's a buzzword, anticipation. A nurse observed a male client pacing, buzzword, and unable to remain still in his room for 8 weeks after 8 weeks on clozapine during morning assessment. Rewrite it. Antipsychotic clozapine, right? Rewrite it. You be on it for 8 weeks. All of a sudden, you pacing and you can't remain still. What is that? This is Akathisia. You have to know it's extrapyramidal side effect, which is Akathisia, right? What is the treatment for this? It's mostly anticholinergic drugs. So you can use anticholinergic to do that, like benztropine. It's one of them. Benadryl. It's one of them. There's so many medication you can use to treat extrapyramidal side effect, right? But guess what? Sometimes the board confuses you. They try to trap you. They won't give you an anticholinergic. There's some few medication you can use for extrapyramidal side effect syndrome, especially akathisia. Akathisia, because they cannot stay still, they're moving around. You can use benzodiazepine, okay? And you can also use beta blocker. So beta blocker to slow them down. So this is a secondary generation antipsychotic test-taking skills. If this is causing the problem, I cannot give you a second generation. This is SSRI, you cannot use it. This is an MAOI. So what you left with is a benzo right there. You can use Benadryl, you can use benztropine. Those are anticholinergic medication that usually you see it in the test. The normal one, if they have akathisia and you don't see anticholinergic, please choose a benzodiazepine or beta blocker, like propranolol. Yeah, so this is a benzodiazepine, so you can use that. What is the next priority diagnosis? This is like a case form, but I do not make a case, but you can get this like a case. A client with history of what? Depression and schizoaffective disorder present to the emergency room with what? Right lower quadrant pain. Client was diagnosed with what? Acute appendicitis. I'm underlying the pathway and was taken to surgery immediately. In the PACU, client developed what? Muscle rigidity and lock jaw in a temperature of 104. Client on fluoxetine and laxatine, right? No prior surgery. What is the next priority? We write these 6 lines in patient has depression, right? And he has some psych issue, schizoaffective disorder, right? He's on appropriate medication. He's on SSRI and the second generation antipsychotic, right? He's on saying as antipsychotic, basically whatever is first, or he's an antipsychotic. That's clozapine, right? What is the issue? No prior surgery. The patient does not have any prior surgery, never had any surgery before. That is the key. Okay. After the surgery, patient developed what? Lockjaw and what? Muscle rigidity. Muscle rigidity. What do you think? Lockjaw, muscle rigidity, and a temperature of 104. What is your diagnosis? This is not neuroleptic malignant syndrome. Although it's on antipsychotic, it's not that because it's been on that medication for a while. And this happened right after the surgery. So no, usually when they start taking this medication, then they develop that problem. They don't get it because they went to surgery. So this is the test-taking skills. Why did this happen? It's not serotonin syndrome. We did not give the patient extra serotonin, even though it's on SSRI, right? It's not an extrapyramidal side effect. Usually, that's akathisia, acute dystonia, Parkinsonism, and tardive dyskinesia. Therefore, what you left with is malignant hyperthermia. Why is it so? He has a lockjaw. He has muscle rigidity. He has temperature, and this happened right after he has surgery. This is how you take a test, using your skills and using it to break it down. You know, patient is being on antidepressant, antipsychotic. He did not had anything to it. It was not given to him, and emergently, he just had surgery, and boom, temperature, lockjaw, rigidity, malignant hyperthermia. Next question, number 4. Which drug combination for the associated diagnosis the nurse should clarify? So, which combination of drug is the problem, right? What do you think? Selegiline, I have what? MAOI. You should not combine it with nasal decongestant because that will increase your temperature. So we have to clarify it. The Ziprasidone is what? TCA. You can't combine TCA with MOI. You get into trouble. Lithium medication you should avoid is anything that affects the kidney. It all causes hyponatremia. ACE inhibitor, that's that. So we got to clarify. Valproic acid, if you take it, you should make sure you add extra barrier method, not just oral contraception, because it can cause birth defect. We don't want you to get pregnant. You cannot just take, this is birth control. Estradiol or Tidebron. You don't need to take them just like that. We need a barrier method. This is not going to be effective. Okay, so we need a barrier method. So we need to clarify. This is a mood stabilizer and second generation antipsychotic. You can combine it together in the patient who has mania. So the one we need to clarify 1, 2, 3, 4. But this is a normal management of a patient with mania. Next question. Which prescription the nurse should question? A nurse is reviewing prescription for 4 clients, right? What do you think? You still have to recognize them. If you don't, then it's a problem. Amoxapine, right? If you recognize this is a TCA, okay, it's a TCA. We're taking metamucil for a client with depression, right? TCA causes constipation. It's anticholinergic. That's why metamucil. That's fine, right? Clomipramine is another TCA. And we're using saline nasal spray for a client with depression because it causes dry nose. So that is fine. Bupropion and lithium. Lithium is a mood stabilizer in the bipolar patient. Bupropion gives you too much energy. If you increase your energy, it's going to worsen your bipolar. We got to clarify this. SSRI can combine with benzos to help with anxiety. So this is a good treatment. So 3 is the problem. That's the way you do this kind of question. See if the combination makes sense. And if you have any issue about it, just question that. Same idea, just to give you a second one. Which prescription the nurse should question? The same thing, 4 clients. I have an SSRI, and I'm taking Tylenol for what? Anorexia patient. It's not a problem. I have SSRI, and I'm taking what? Sildenafil for client with depression. Why? SSRI causes sexual dysfunction. So you're taking Viagra. It's not a problem. Nafazodine. Okay, this is a atypical antidepressant. So this is atypical antidepressant. And he's taking what? Tramadol for depression, right? Both of them. The patient has depression, he's taking nafazodine, and he's taking tramadol too. Tramadol increases your serotonin. Nafazodine also increases your serotonin. We have 2 things going together in the wrong direction. That is what you get serotonin syndrome. So 3 is bad. Provasamine and what? Oxazepam. What do you think? This is what? Benzos, and this is what? SSRI. You can combine SSRI with benzos to treat anxiety disorder. So 3 is a problem. This is the hardest questions I've created. So bear with me, but if you go through that, you master the name of the medication, you see they are easy. So keep charging as always. Number 7. A nurse is caring for a client prescribed what? Lovominazepam. Okay? Long name. It's easy. Don't worry about it. Which statement from the client need immediate intervention? What do you think? Which statement that the client need immediate intervention? You have to recognize what kind of medication this is. And what is it? Lovominazepam is a serotonin norepinephrine reuptake inhibitor, not SSRI. It's SNRI. So it's a different class of medication. What is the major side effect of this problem? It's right there in front of you. You can figure out, even if you don't know. Most antidepressant causes insomnia. I will take the medication, only few of them. I will show you them. I have a question in it. I will take the medication in the morning because it causes insomnia, right? If you don't know, most of them causes insomnia, so you take it in the morning. I will take the medication with food. Most causes GI problem, so you take it with that. I will notify my doctor with new diagnosis of glaucoma. This you may not know, but it's classic for this kind of medication. Even if you don't know, leave this behind. Go down. I will begin to enjoy social activity. Guess what? This medication, SSRI, both antidepressant, antipsychotic, affect your sexual drive, and you develop sexual dysfunction. That's why patients don't take it, non-compliant. Therefore, you know that the only thing that need the immediate problem is this one. If you don't know, you can figure it out. This is a problem. This is not true. Then you can get the answer. It's number 4. Should suspect as the cause of the insomnia. A nurse is caring for a client with depression who report of severe insomnia. I told you, most antidepressant causes insomnia. So which one do you think is the problem? This is a SSRI. You take it in the morning because it causes insomnia. The Lucidin is also SSRI because it's insomnia. You take it in the morning, right? Bupropion is atypical antidepressant, causes insomnia. Take it in the morning. These two are also atypical antidepressant, but they're very good to treat insomnia. This is treat insomnia. If you can't sleep, this is the medication we put you on. So these medications are very, very good because they can be used to treat insomnia. You can take it at night. These are all the few medications you can take it at night. Trazodone and metazapine can be used taken in the evening because it does not cause insomnia and it helps to treat insomnia. So 1, 2, 3 are the problem, okay? And 4 and 5 can be used to treat insomnia. So this is all content revision. At the same time, show you how to answer questions. So, which of the following the nurse should monitor? A nurse is caring for a client prescribed Lamotrigine for acute mania. So, you look at it, you circle Lamotrigine, acute mania. You know this is a what? A mood stabilizer. Okay, you have to know specific side effects. Only few of them. Okay, only few side effects of this problem. Okay, so which one should the nurse monitor? Okay, it causes GI problem, so we want to monitor, right? It does not. I did. This is the trap question. Okay, I put this there because I know 80% people would choose agranulocytosis if they don't know the answer, because that's the most dangerous, right? Guess what? It does not cause agranulocytosis, but that's the trap. When you take it the test, expect, because you see that it says the most dangerous there, but this medication does not cause agranulocytosis because it's GI problem. It's one of the mood stabilizers with few side effects, nausea, and it causes double vision and headache. So among the 3, which one is more dangerous? Among the 3. So I'll choose double vision. So you should not operate the machinery because it can give you double vision. And that's what you have to worry about. That it does not cause agranulocytosis. Number 3. Which of the following medication the nurse should suspect as the culprit? So what is causing the problem? A nurse is caring for a client with what? Acute mania. Circle it. Client was prescribed a mood stabilizer. So the answer choice has to be a mood stabilizer for the current condition. 3 days later, client report of what? Mid-epigastric pain with what? Amylase of 4,000 and lipase of 5,000. Which of the following medication is the nurse should suspect as a culprit? Break it down. I have mania, okay? I prescribe a mood stabilizer. All of a sudden, my lipase is HAB. My amylase is HAB. I have abdominal pain in the mid-epigastric. What is this? Pancreatitis. This is my pancreatitis. Which of these causes pancreatitis? That's what the question is asking you. Don't overthink it. We saw Lamotrigine causes blurred vision, right? You saw Valproic acid. They are teratogenic. You can use it when you're pregnant, but all of them have specific side effects. And the classic medication that causes pancreatitis among all mood stabilizers is Valproic acid. Is the number 1 of that causes pancreatitis. So that is its name. It causes pancreatitis. So when you see that, you got to report it. Severe pancreatitis, Valproic acid. Carbamazepine does not do that. It has blood level thrombocytopenia, other factors that it causes, but they all are teratogenic, but each of them have their own specific thing. Valproic acid, pancreatitis. Number 11. Which of the following teaching the nurse should include at discharge? I have to include something at discharge. The client was prescribed trifluoroperazine and triphenylphenidyl for a new diagnosis of Tourette syndrome. A bunch of words, bunch of T's, a bunch of big words. Trifluoroperazine, right? Trioxyphenidyl. So another medication for Tourette syndrome. Remember, when you see Tourette syndrome, don't say, oh, I've never seen this before. Ignore it. It's not a buzzword. All schizophrenic and their spectrum. So Tourette syndrome is a spectrum of that. All these medical problems, schizoaffective, they are a spectrum of disease. So if you don't know, just say, don't boil it in. Pay attention to the medication. Try trioxyphenidyl and trifluoroperazine for a diagnosis of Tourette syndrome. Which of the following teaching the nurse should include? Then you come, you said, what is this? This is first generation antipsychotic. And this is what? An anticholinergic. Why do you combine first generation antipsychotic and anticholinergic? To prevent extrapyramidal side effects. Most of them, you know them. So this is an anticholinergic. You got to teach the patient. Chew sugar-free gum daily. Yeah, you get dry mouth from anticholinergic, right? Rinse your mouth frequently so that your mouth is not too dry, right? Drink 2 to 3 liters of water a day to prevent constipation, right? Call the clinic with new onset of muscle rigidity. Yeah, if you get muscle rigidity, we're talking about this. This is what is causing you getting neuroleptic malignant syndrome from that. You will need frequent lab draw. You don't need it. So there's 2 medications. One can cause big problem, neuroleptic malignant syndrome. One causes anticholinergic. So this side effect goes here and this goes here. You got to teach all this to the patient to know anticholinergic effect and NMS from the first generation antipsychotic. Selected apply. Like I say, it's a teaching, so that's why I do selected apply. So that you make it comfortable. You just ace your test. You don't have to worry. And nurses are renting new graduate on the mental health clinic. Which of the following the nurse should include as atypical antidepressant? Atypical. By now, you should recognize this is antipsychotic. By now, you should remember this is also antipsychotic. This is first generation, this is second generation. This is SSRI, it's not atypical antidepressant. Okay, and this is SNRI, is not atypical antidepressant. The only thing that is atypical is Valproic. It's one of the nefazodine we saw, or trazodone. They are in the same group. This is atypical antidepressant. Just to make you comfortable, you get used to them so that you see them, you say, oh, I've never seen this medication before. Here you go. Look at the first page I gave you. Same thing, selected apply. What do you have here? Which of the following the nurse should include? Selected apply. A nurse is teaching a client with anxiety prescribe what? Alprazolam. There's only 2 words. Which teaching I should include? I'm taking Alprazolam for anxiety, and what should I include? This is benzodiazepine. It's no brainer. What things should you avoid when you're taking benzo? The way to remember them is benzo is a downer, so things goes down. Don't take any downer anymore. Alcohol is a downer, it's sedating, right? Number 2, cyclobenzaprine. This is Flexeril. It goes down. It's used for muscle relaxation. It will make you go down deeper. And those people take it for anxiety. If you take it, you go down deeper to the hole. St. John's doesn't do that because it does not affect Alprazolam. Grapefruit juice, if you see that, never pick it. Don't think it's a good thing. It's always a bad. So grapefruit juice. Which of the names you include? Yes, include grapefruit juice. You should not take it. Never take grapefruit juice in it. So you should avoid it. So avoid this. Avoid the grapefruit juice. Avoid that. Avoid that. Avoid that. St. John's doesn't do it. It's not part of the benzos. It does not affect benzos. Which of the following prescription the nurse should clarify? Select or apply. Same thing, right? This question is asking something specific. A nurse is caring for a client with schizophrenia and newly diagnosed mania episode, right? With whom beta ACG was positive, right? You have schizophrenia, and then you've been diagnosed with mania at the same time, and your pregnancy test is positive. Which of the following prescription the nurse should clarify? Well, you pregnant? Well, you should avoid mood stabilizers, right? Right. You should also avoid second generation antipsychotic, right? And you should also avoid what? Benzos, right? And what else? The last one, do you recognize it? I hope you do. I hope you do. It's a mood stabilizer. It's also a mood stabilizer. So all of them you should avoid. Lithium, mood stabilizer. Lamotrigine, mood stabilizer. Olanzapine is antipsychotic. Clozapine, it's also it's a benzo. And the last one is a mood stabilizer. Oxcarbazepine is also a mood stabilizer. So all of them is a mood stabilizer. They are all teratogenic. So the lady is in trouble. You can't take any of this medication. Select and apply. What do we have? Number 15. So what do we have? A nurse is caring for a client prescribed triamine, right, for severe depression. Which of the following in the client history will make the nurse question the prescription? Do you recognize this? I'm taking this. I need to question this in the history. What is this? TCA, right? You have to know TCA does. They have dermatitis, right? They have what? Anticholinergic effect. They have neurological effect. They have cardiac effect. That's the TCA dance, right? Which of this will you question? Angle closure glaucoma? Of course, yeah. You can take anticholinergic. I got a question. BPH, urinary retention. I have to worry about it. Recent MI, yes. Your heart is going to make your heart not work the way it's supposed to. If you take anticholinergic, well, it's going to speed up, okay? Yeah, it's going to speed up, okay? And it's not good. Sjogren syndrome, you have to know this. Sjogren syndrome is a autoimmune disease where all secretions are dry. Saliva, you don't get saliva, you can cry, your secretion, semen will be dry, vaginal area will be dry. So you teach this patient to take sugar-free candy, put eye drops, and have a lubricant during sex. So anticholinergic, if you do that, it's going to block all of them. It's going to be a problem. Now it's going to worsen their problem, right? How about myasthenia gravis? Do you want to give anticholinergic to a myasthenia gravis? No. Okay. Myasthenia gravis need cholinergic effect so that they can function. When you give them anticholinergic, no, they cannot function. That's why when they go into crisis, you give them what? Atropine, which is anticholinergic. So now they are not in crisis. If you give them anticholinergic, they are in trouble. So this. So with this, our question: 1, 2, 3, 4, 5. Asthma, think about it. We use bronchodilators, and which are anticholinergic, imipramine, to help with that. So it's not a problem. This is a good question to keep you thinking about anticholinergic and how they can frame something like that for you. Number 16, select or apply. What do you think? A nurse is caring for a client prescribed paroxetine. If you recognize the medication, the rest is done. For generalized anxiety disorder, for all these psych, even every pharmacology, I recognize it, I'm done with it. I know what it is. And I've told you what it's used. It's for anxiety. The client report grinding of the teeth at night. Which of the following intervention is appropriate? This is specific for SSRI. This is what we call Bruxism, basically. And when you see that, you should not increase the dose. You should stop the medication, switch to another one. Change to fluvoxamine. It's still an SSRI. You should not add another medication. Take the offending agent there. Change to what? There's Valproic. This is SNRI. So this is a new medication, and recommend a mouth guard at night. You can put something in your mouth so that you don't clench your night. But a new medication and recommend a mouth guard is applicable. So 4 and 5 is the best answers. Are the best answers. Number 17. What do you think? Which of the following teaching the nurse should include? A nurse is caring for a client prescribed Ziprasidone. Do you recognize this? Second generation antipsychotic. What do you think? Few things about them. The medication is likely to improve my search drive. Negative. It goes down. I am at risk for mild seizures. It does not cause seizures. I will take the medication in the evening. It causes insomnia. And therefore, you're left with that. Most antipsychotic, weight gain. They increase your lipid, so hyperlipidemia. And it causes diabetes. These 3 things, if you don't know, every antipsychotic is associated with that. I mean, weight gain, hyperlipidemia, and diabetes is common. So you teach them. Even antidepressants do the same thing. Weight gain, go to the gym, go to the gym, go to the gym. Number 18. Select or apply. A nurse is providing discharge teaching for a client prescribed what? Buspirone. Which statement by the client need immediate intervention? So buspirone, I need to intervene. This is not bupropion. This is, you see, it has a bastard, buspirone. This is for mostly anxiety, but it can be used for depression. Okay, the key to remember this is BAS. Okay, most anxiolytic like benzodiazepine is used for anxiety, but it causes dependence, withdrawal, and this sedation. And so you got to take it certain time. You have to be careful with them. Buspirone is lifesaver. You can take it. There's no dependence. There's no withdrawal, and there's no sedation. These 3 things, they're going to trap you. No sedation, no withdrawal, and no dependence. So you can take it anytime. You can take it in the morning, afternoon, in the evening. It does not cause insomnia. It does not, basically, that's key. So I will take the medication for my anxiety. Okay. It will take about 2 weeks. This is the only problem. It takes longer to work. Most people want things quickly. So that's why they give them benzodiazepine. But for this, it takes a while, sometimes 4 weeks, 2 to 4 weeks to work. So this does not need immediate intervention. I will take it at night so that I can drive. I told you it does not cause sedation. So this needs intervention. I will need to notify my medical doctor with suicide thought, with everything. Yeah, this one causes, you can have suicidal ideation with it. I will notify MD with positive pregnancy test. And most antidepressant, antipsychotic, sometimes pregnancy, for especially this one, is not compatible. So which statement by a client need immediate intervention is only one. So this is good, this is good, this is good, this. The only one that need immediate intervention is number 3. So you can see I intentionally said this to re-emphasize the fact that you can have one answer choice for a substance. If you choose more than one, you get it wrong. So don't rush to pick them. Pick those that you think you're very confident about. If you're not, leave it behind. Number 19. Select to apply. And this is caring for a client prescribed what? Venlafaxine. Which statement by the client indicate proper understanding of the medication? Once again, recognize what medication it is, and then the rest is history. This is what? SNRI, right? So, what do you think? I will take the medication for my anxiety. It can be used for anxiety, for depression. I expect some decreased libido. Of course, this one, yes. I will take the medication with food, GI symptoms. I will take the medication in the morning. What? Insomnia. I can still operate machinery after taking medication. It causes blurred vision. It causes blurred vision and glaucoma. So it causes problem. So because of that, you cannot take it. So this is wrong. So which indicate proper understanding? This is good, this is good, this is good, this is good. Because it's dizziness and blurred vision, so you can do that. Last one. Which of the following assessment finding require immediate intervention? A nurse is caring for a client prescribed what? Phenaxine per request. Do you recognize this? If you don't, it's a problem. You have to recognize it. So this is what? MAOIs. And then the rest of the question is easy. What do you think? You have to know. You have to avoid nasal decongestion. You have to avoid thiamine product. So that's the key. I will use water saline solution when I get cold. Yeah, when you get cold, I don't want you to use nasal decongestant. Just use saline. I'm good. You take NSAID for back pain. No problem. You cannot eat pepperoni because it has thiamine in it. So you should avoid thiamine. And you should stop taking your SSRI. Otherwise, you get serotonin syndrome at least 6 weeks. So this is good. So which of the following findings require immediate intervention? Well, you can't eat pepperoni. This is the end of the series. 3 question videos. Total 60 questions. All of them are 20. Sit down, go through them, try to do them quickly with good content, and then see if you have more problem. But you should be comfortable with mental health pharmacology. And if you're not, just send me an email and I'll figure out something. All the best of luck. Keep charging and subscribe. The link down for more content like this. Take care of yourself and all the best of luck. Bye-bye.